I will talk about lung cancer clinical and animal experimental data. Basically, what is the problem with the lung cancer? So this is the leading cause of cancer deaths worldwide. There are differences in countries. Unfortunately, Hungary is a leading country regarding the incidence of lung cancer and the deaths of lung cancer. You can see here some comparison of different countries from Europe and our bad rank. What is the cause of lung cancer? We know mainly the cigarette smoke. So if we can avoid cigarette smoke, we can prevent the majority of lung cancers. The other problem with the lung cancer, the screening. When we observe the lung cancer, we can observe in the late stage of the lung cancer. So the curability of the cancer in the late stage is very bad. The additional problem with the lung cancer, the poor survival of patients. So the therapy could be improved. We designed a study with lung cancer patients who received deuterium depleted water after the diagnosis of course, the disease, but the duration of the consumption of the deuterium depleted water was different by patients. The median age of females and males in the study was same, 58 years in the two groups. The mean age was a bit different. And the range of the age of the participants was from 36 to 83 years. The cross-section of the population of the lung cancer population represents the normal lung cancer patients who don't receive the treatment of deuterium depleted water. So we can see the types of lung cancer here. It is different by sex groups. Adenocarcinoma of non-small cell lung cancer, planocellular carcinoma of non-small cell lung cancer, small cell lung cancer, and the other, which is a mixed group. Our earlier data show that the survival of patients, the median survival was 22.5 months, and with a confidence interval of 18.5 to 33.8. Now I would show you data after 4 years of the preliminary data. You can see here that the median survival, the total median survival increased from 22 to 32.9 months. And we can distinguish different curves by sex groups. Unfortunately, there is a drop of the curve at the beginning, after the beginning of the consumption of the deuterium depleted water, but this is normal in the lung cancer patients. So unfortunately, we lose most of them at the beginning after the diagnosis. So if we compare the two curves by two sexes, the statistically significant difference can be found, and the median survival within men is 25.6 months, and in women population it is 46.9 months. there is a special group, the group of patients with brain metastasis, and the median survival in brain metastasis group was 26.9 months, and the 1 year survival was 81%, and by 5 years it drops 26%. So these are cumulative survival probabilities.